They are giving us an update with regards to the provincial government's plan to roll out phase 2 of the COVID-19 vaccine. Northwest, we're told, is one of the provinces that has seen an increase in COVID-19 positive cases. Let's go there now live.
307. The total number of confirmed cases is 69,291, with 64,398 recoveries. The recovery rate in the province stands at 92.9%. We have recorded 1,758 deaths with active cases at 3,135 by this past Tuesday, and we had by then administered 22,558 vaccines as of this past Tuesday. Now let's look at a summary of the status quo. There is an increase in daily positive cases observed, or there was, in the past few weeks in the province, and the weekly numbers increased between weeks 13 to 15. However, overall active cases continue to decrease, leading to an increase in the recovery rate. Patient numbers in ICU and those on ventilation continue to decrease, and the current case fatality rate is 2.6%, which is still below the national average of 3.4%. The Northwest current average recovery rate stands at 93.3%, which is slightly below the national recovery rate of 95%. Ladies and gentlemen, the number of Northwest healthcare workers vaccinated under the Sisonke protocol is 22,289 as of Tuesday, 11th May 2021, and a total of 40,000 actually registered for phase 1, which means they are still just below 18,000, including healthcare workers and traditional health practitioners who have registered but have not yet been vaccinated. We would like to call upon all those who have registered in phase 1 to come for vaccination before the start of phase 2. And as a result, there are changes in scheduling of phase 2 vaccination. The first week of vaccination with Pfizer, starting next week on Monday, 17th May, will focus on healthcare workers who have registered but not vaccinated yet, and those residing in old age homes across the province. All healthcare workers who haven't yet vaccinated are to get vaccinated this and the next week. This therefore means that the EVDS, where registration takes place, scheduling of those 60 years old and above will not happen next week, but at a time that will be announced in due course. A noticeable change in attitude and behavior of citizens towards COVID-19 prevention and control measures, such as wearing of masks, maintenance of physical distance whilst in the public space, disobeying of hand hygiene and hand sanitation rules, may have possibly been one of the causes of the increases we have seen in recent times. Other possible causes are the increase in low risk perception by some members of the community, particularly those who have previously contracted COVID-19, the inadequate adherence to strict infection control and prevention practices in healthcare facilities, the inadequate adherence to COVID-19 protocols at workplaces and business premises as the economy has been reopening, the inadequate adherence to non-pharmaceutical interventions in some cases, and the easing of lockdown regulations to level 1 as announced by the President. As a means to mitigate the rise of new cases, we are enforcing adherence, particularly in public places, malls, funerals, weddings, taxi ranks, and other public gatherings. Some members of the public have unfortunately let their guards down in some of our areas. We are also facilitating the protection of staff against contracting COVID-19 and ensure workplace compliance across all sectors, including the mines, the continued identification of hotspot areas for targeted intervention, intensifying screening and testing at hotspots, intensifying contact tracing, maintaining quarantine facilities, and prevent further spread through isolation, sustained surveillance, active monitoring and analysis of COVID-19 data, and the district-based response plans to resurgence. We have also begun intensifying our vaccination drive to achieve population immunity, sometimes called herd immunity, fostering interdepartmental and intersectoral collaboration, increasing material and human resource support to COVID-19, and continuing to communicate prevention measures to the public. We are also intensifying high-level interventions with a specific focus on governance, leadership and coordination, epidemiology and surveillance, facility readiness and case management, and occupational health and safety, risk communications and community engagement, human resource for health, medical supply and supply chain, port health and environment health, information systems and data validation, as well as maintenance of essential healthcare services. Ke rata go ka tsaya tshono e go tsibusa baagi ka kakaretso gore go a bonala fa dipalopalo tsa ditshwaetsego di oketsega letsatsi le letsatsi mme fela fa motho o di leba ka botlalo e nna o kare di kwa tlase seo se na le bokgoni jwa go re tsietsa mme ra feletsa re thanya lomapo lo tsebeng mme ka nako eo dipalopalo tsa ditshwaetsego di tla be di ile magoletsa ba gaetsho ka jalo go tla nna botlhokwa gore re ikilele re le setšhaba bogolosegolo ka go sala morago ditaelo tse bontsi jwa rona re setseng re di itse sentle e leng go apara dipipa melomo le dinko tsone dimaske ka dinako tsotlhe go netefatsa fa go nna le sekgala mo gareng ga rona le bangwe ka rona go tlhapa matsogo ka dinako tsotlhe ka sesepa le metsi kapa go dirisa tsone di sanitizer ga mmogo le go ipokotsa mo mafelong a o tla fitlhelang go kgobokane batho ba le bantsi jaanong fa re ka dira seo mmogo re ka nna le tšhono ya go ka efoga lekhubu la boraro third wave la COVID-19 mme ra netefatsa fa bokamoso jwa rona le bangwe ka rona bo bolokesegile ka wa mafoko ba gaetsho ke a leboga.
Thank you, Premier Leboga. Colleagues, before we open for a round of questions and interaction with the Premier and the Command Council, that number that I had committed to share with you for our colleagues who are not physically present with us here, but are joining us on various social media platforms to allow them also to engage. They are able to send questions on WhatsApp questions on this number 079 888 7564. I'm going to repeat it again 079 888 7564. And I would just appeal to them to keep their questions brief and relevant also to the statement. Any other issues that are not in the statement can be dealt with, or not related to the statement can be dealt with at other forums and platforms outside this gathering. Colleagues, with those few words, let's take a round of hands. Same drill again. Once you get an opportunity to interact, tell us who you are, which media house you represent, and at least at the most 2 questions per person. And let them be brief and straight to the point. No preambles. Can we have a round of hands from colleagues, if there's any? 1. Going. Okay, for now, let's take the hand here.
Good morning, colleagues. My name is Sandrine from SABC News. I understand that you said that the vaccination for over 60s has been postponed to later date. Can we have sort of a commitment as to when that will unfold? As well as what are the government plans to fast-track registrations, especially for those with vulnerabilities that are over 60 in most of our rural areas, particularly the farming areas?
While the Command Council is readying itself to respond, is there any other question? Okay. Premier will take guidance from you in terms of the responses.
MEC Health and his team will be putting response.
MEC Sambata, if you can kindly come to the mic.
Thank you very much. The last one. The last one on help on registration. First, EVDS, as is currently, has been adjusted compared to when it started with healthcare workers. It now allows a person to be assisted by another person who has access to the system. So in a community or a family where the elder who's 60 and above has no access to a cell phone, a grandchild who has access to a cell phone can register and use the number of where the confirmation must be sent. That then allows an element we call in health assisted registration, exactly your question. We do have a campaign provincially in each sub-district where we have teams that are going to areas that are having a problem of accessibility. And in some instances, we're working with House of Traditional Leaders to use traditional offices as places for assisted registration. If you would go closer to the areas in the borders of Botswana, one of the challenges there, Honorable Premier, is that the network is Botswana network, yet it's South African communities. So we're debating the best way of how then to register them. Do you mobilize them to an area where it's a South African network? You register them and then transport them back, because by that time they would have a confirmation of registration. And that one is an issue of network dominance. You would be in South Africa, but the dominant network would be a Botswana network. Now, that element of assisted registration covers everybody who's in the outskirts, because our plan is to ensure that registration and vaccination of 60 and above, instead of being less on rural communities, it must favor them, because you may find them more scattered, but it helps in a village of 5 homes to have 2 vaccinated, to then help you on the element of population immunity. That one has a program. We're doing that because leaving it to themselves, it's giving us the revelation that we still have even today, that there's still a lesser number nationally of 60 and above that are registered. That's the problem. Now, going to the first question. Remember, had we used AstraZeneca, we would have dealt with healthcare workers as per the original plan. Immediately it had to be shifted, and then we opted for Johnson & Johnson that was available. Then the numbers of available vaccines was reduced drastically. So in the vaccination program for healthcare workers, the problem, it's not the failure of government to vaccinate. It's the available vaccines that we've been dealing with at a lesser number compared to the number of healthcare workers. And that then has costed, remember, this week was the last week for healthcare workers. Because of that small number of vaccines available, it has costed a shift to give healthcare workers a last week of next week, which therefore shifts the starting of the over 60 with a week. This one is on the basis of covering a greater number of healthcare workers who would have not been covered because of available vaccines but have registered. If you go to what the Premier has said, the Premier discloses that we have vaccinated 23,000, yet our registration is around 44,000. So we still have more than 20,000 of those who have not been vaccinated. When the Premier made the call, Monday and myself, just Tuesday I got 3 calls from them. They're saying you must go and be vaccinated, but there's no vaccine. And that was true because the next batch is for next week. That's why they are shifted. So it's a tactical shift on the basis of giving space to finalize the healthcare workers. At least close to 99% must have had vaccination. The drive we should do is to call all of them. That more than 20,000 in Northwest who have not come to vaccinate, to start by Monday, ensuring that they go into areas where they should be vaccinated. Thank you very much.
Thank you, MEC. Colleagues, any other question? Do you have a question, Tebe, on the social media platforms?
Yeah, we have 2 questions. One from MT Mate.
All right, we're getting a sense of the state of play with regards to COVID-19 in as many provinces as we can. Why? Because there is this fear of a possible third wave. Remember, the health ministry released a statement saying that we are not currently in a third wave as yet, but the fear is there. High alert is South Africa. We want to know from you with regards to our question of the day, basically asking for your comments in terms of, give us your tips about how to cope with COVID fatigue in order to try and stave off a potential third wave of the pandemic. You heard the situation of what's happening in the Northwest. The Premier there, Mokgoro, saying that there are still some in the public that are letting their guard down. The current numbers with regards to COVID in that province, Northwest, over 1,700 people have lost their lives. The recovery rate, total recovery, is over 64,000, and current active cases is just over 3,000. So that's the current situation with regards to COVID-19 in the Northwest. But the message is, don't let complacency be the enemy of progress, how much progress that we've made over the past couple of months. But please send us your thoughts with regards to how do we cope with COVID fatigue, with this threat of a third wave. At the agenda _SABC. We've got some comments, let's put it up, see what you have to say in this regard.